Today, we have the privilege of meeting two incredibly inspiring doctors, Dr. Elizabeth Markle and Dr. Benjamin Emmert Aronson, co-founders of Open Source Wellness, who are changing the way the medical community approaches behavioral health. Welcome to you both.
Thanks so much for having us.
Pleasure to be here.
Thank you. Well, I want to ask both of you, what drew you to this wonderful work and this nonprofit that you've started?
Sure. Well, I'm a psychologist by training, and I spent many years working in big healthcare settings, supporting patients and supporting doctors. And what I found is that across diagnoses, so whether a patient has diabetes or depression or heart disease or something else, and across specialists, so whether it's a primary care doc or a cardiologist or a psychologist, doctors are constantly making the same 4 behavioral prescriptions. And you can probably guess what these are. They are exercise more, eat better, reduce your stress, and get some social support. And then the depressing thing is that they then say something like, good luck with that, I'll see you in 6 months. And so Ben and I would have conversations where we'd say, wait a minute, if a doctor is going to prescribe medication, like antibiotics, they would never say, you should start antibiotics. Good luck figuring that out, I'll see you in 6 months, right? They would say, your antibiotic will be ready at the pharmacy around the corner and your insurance will cover it. So we set out to create the behavioral equivalent of a pharmacy, or a accessible, affordable delivery system for the health behaviors that really drive human health and well-being.
Wow, that's wonderful. And Ben, how about you? What inspired you to work in this field and to start this?
Yeah, frankly for me, I was tired of seeing my patients die just because they were poor. In our country, health and wealth are inextricably linked. So my patients with privilege were able to access structural support when they needed to make a health change. They could go to exercise classes or hire a health coach. They could shop at Whole Foods. But for my low-income patients, these resources were just out of reach. And so their entirely preventable diseases would get worse and worse. And they'd show up in our ERs and in our hospitals. And like Liz said, I just felt that we could do better.